Okay, we're gonna run through the scapula or shoulder blade. So one of the most important things that you need to be able to identify with the scapula is whether it's a left or a right, as well as the anterior surface and posterior surface. So how do we do that? One of the first things we're going to look at is this nice smooth surface is going to be the anterior surface. Okay, this is the side that runs right up against the rib cage, so it makes sense that it's nice and smooth. This is going to be the posterior surface with this bony prominence across here. So this is going to be posterior. And if you look on the lateral aspect of the scapula, you can see this circular indented area. This is the glenoid cavity. And this is the area that articulates with the head of the humerus, which is going to come up and form the glenohumeral joint or shoulder joint. So we know that glenoid cavity is always going to face lateral, and this side is always going to face posterior. So with this particular scapula, this would be a right scapula. So let's look at a couple landmarks. Let's start anterior. On the anterior surface, you have this indented area. This is going to be the subscapular fossa. Okay. If we look posteriorly, we can see a couple different things. This bony prominence that extends from medial to lateral is going to be the scapular spine. And scapular spine is going to end in this bony projection here. This is the acromion. So the acromion is the bone that articulates with the clavicle and forms the acromioclavicular joint. If we come just superior to the scapular spine, we have this fossa right here. This is the supraspinous fossa. And then if we go below the spine, we've got the infraspinous fossa. In terms of borders of the scapula, we've got, it's kind of triangular shaped. So we've got three borders. We've got the lateral border. This would be the medial border or vertebral border, because this is going to be the side that faces the vertebral column, and then superior border here. Okay. Also of clinical significance is the inferior angle. So this is easily palpated on patients. So inferior angle would be here. And we already talked about glenoid cavity or glenoid fossa. And the anterior projection here would be coracoid process.